Next morning, everyone. The topic is glutathione deficiency, a hidden factor in ADHD. I really got to know it. I think we have talked about autism a lot, and many of us, rightly or wrongly, just also dump ADHD as part of the autism spectrum disorders, even though they are separate. But those with ADHD have a higher uh, uh, a chance of becoming autistic also. Okay, so ADHD or attention deficit or hyperactivity disorder is a group of behavioral symptoms that include inattentiveness, that's the attention deficit, hyperactivity, and impulsiveness. And symptoms of ADHD tend to be noticed at an early age and may become more noticeable when a child's circumstances change, such as when they start school. Most cases are diagnosed when the children are between 6 to 12 years old, even though the symptoms may appear before 6, but they're diagnosed usually at this age. And also, by definition, they should be diagnosed before 12 years old. Okay. The symptoms usually improve with age, but many adults who are diagnosed with the condition at a young age continue to experience problems. People with ADHD may also have additional problems, such as sleep and anxiety disorders. And the symptoms of attention deficit hyperactivity disorder can be categorized in two types of behavioral problems. That's the attention deficit or inattentiveness, and the hyperactivity plus minus impulsiveness. Most people with ADHD have problems that fall into both these categories, but this isn't always the case. Example, there are some who are inattentive but not hyperactive, and strictly they don't have ADHD, they have ADD, only attention deficit disorder. I think we can imagine what is the hyperactivity component. You know, they are they are nonstop running all over the place. Obviously, not having the normal behavior. But we may have less familiarity with the attention deficit. What does that mean? These are some examples. Having a short attention span and being easily distracted, making careless mistakes, for example, in schoolwork, appearing forgetful or losing things, being unable to stick at tasks that are tedious or time-consuming, appearing to be unable to listen to or carry out instructions, constantly changing activity or tasks, and having difficulty organizing tasks. Well, you heard Joel said that in Malaysia, the prevalence is 3.9%. That was 9 years ago. Obviously, is severely underdiagnosed because worldwide it is 7.2%. With more than half of that persisting into adults. And the diagnosis of ADHD is more frequent in boys than in girls. Although ADHD is a childhood disorder, a large percentage of children continue to have symptoms in adolescent life. Approximately have symptoms as adults. So this condition impairs the psychological, social, academic, and occupational function of those affected. And this disorder is linked with a range of comorbidities, example, depression, anxiety, substance abuse, conduct disorders, criminal behavior, and also linked with developmental conditions, example, the autism spectrum disorders, as mentioned earlier on. What are the non-risk factors? There's a very high genetic component, estimated to be 70 to 80%. And then, if the child while being carried by the mother was exposed to tobacco and alcohol, nutritional deficiencies, viral infections, and was obese during pregnancy, then the risk increases. And then if those who were born premature or had low birth weight also have higher risk. And finally, if they're exposed to environmental toxins and pesticides, they also have higher risk of developing ADHD. Okay, what are the current treatment for ADHD? Of course, since this is a behavioral problem, then education and psychosocial therapies is a big part of it. But because it is very difficult to get them to behave normally by just counseling and psychosocial therapies, a lot of medication is used for ADHD. And these are grouped into psychostimulants and non-psychostimulants. Unfortunately, both classes of drugs have a wide range of side effects if used long-term, and some may be serious. And many of these actually promote oxidative stress, since we are the subject of oxidative stress. Below, I listed some of the side effects of the psychostimulant and the non-psychostimulant. You can see that apart from the usual headache, dry mouth, anxiety, nausea, long-term psychostimulant treatment also affect growth. Okay, and also the heart, cardiovascular events. Even the non-psychostimulant can have a serious effect, can also affect the heart function, okay, other than the vomiting, diarrhea, dizziness, fatigue, nausea. So it is best not to use these drugs, and if used also at the lower dose and for short duration. But sometimes the cases are so bad, the psychiatrists in charge have no choice but to use these drugs in higher doses and for long term. And then they have to face all these side effects. Okay, now we come to the part that's relevant to glutathione, because the topic is glutathione deficiency and ADHD, the hidden factor in ADHD. Okay, so this is a neurodevelopmental disorder of childhood. And then it is known that there are abnormalities in several brain regions and disturbances of neurotransmitter pathways when the brains are studied. Even though the pathophysiology of ADHD is still not completely understood, but at least we know that it is multifactorial, meaning there are many factors involved. But among the most prominent factors that have been only quite lately focused upon are oxidative stress and inflammation. So here it is called neuroinflammation because it specifically refers to inflammation of the brain tissue or the nerve cells, neurons. The imbalance between oxidants or free radicals and antioxidants, and also the treatment with the medications are two factors that increase oxidative damage. So, okay, first there is oxidative stress because of excess free radicals over antioxidants. And unfortunately, the researchers have found out many of the drugs used to treat ADHD actually promote oxidative stress. So in trying to treat the disease, they are adding to the problem, even though temporarily they reduce the symptoms. So this is the unfortunate situation with the use of the drugs. And the presence of inflammatory disorders, any inflammatory disorder, any situation of altered immune response, especially autoimmunity, for example, and then genetics, we mentioned that this is highly ascribed to the genes because from 70 to 80% hereditary factor is involved. And then there are the environmental factors, meaning, for example, toxins and pesticides, for example. All this will affect both oxidative stress and the neuroinflammation. So let's focus on oxidative stress and the brain. Oxidative stress in the brain can harm the integrity of neurons because the brain is rich in PUFAs. PUFAs are polyunsaturated fatty acids that are highly susceptible to oxidation. This condition could cause oxidative damage of the neurons, which are rich in mitochondria. And we all know mitochondria are the power generators of our cells, and neurons are rich in mitochondria because neurons are always firing, are always working, always firing signals, giving instructions to the entire body. Okay. Even the tip of your toe has a neuron, well, not just a neuron, has many neurons regulating it and sensing taking in all the information that your toe is sending. And also at the same time, the neurons also send commands for the toe to move, etc., etc. So no part of the body is without a neuronal involvement. So the mitochondria can regulate the redox state, that is the balance between the free radicals and the antioxidants. It also regulate the ion homeostasis, and the many ions in our cells. Apoptosis is the programmed cell death, cell signaling, and as the powerhouse of the cell, mitochondria also produce ATP, which we are now very familiar with. Thus, mitochondria generate a lot of reactive oxygen species, free radicals, causing metabolic disturbances that lead to cell death or diseases, including neurodegenerative and psychiatric diseases. Okay, so mitochondria do a lot of work. They produce ATP, but as a byproduct, they also generate or produce a lot of free radicals. And if the free radicals are not taken care of, then it start interfering with the function of the mitochondria, causing metabolic disturbances, which will cause cell dysfunction, which may cause disease and even death. Okay, so oxidative stress is a major factor affecting the health of our cells. Let's look at inflammation, specifically chronic inflammation and the brain. Inflammation is actually a protective response to diverse types of tissue damage. You know, when you have damage, there is an inflammatory response. But if the tissue is chronically inflamed, it causes an increase of reactive oxygen species, free radicals, which can lead to cell death, just as what happened in the mitochondria. Inflammation, chronic inflammation anywhere can cause similar damage. Oxidative stress modifies the inflammatory response. Thus, when there is a redox balance, the inflammatory response is a defense mechanism. Okay, remember, the inflammatory response is actually a protective, defensive response. And it is so provided there is a healthy redox balance. I mean, the situation is normal. But when there is a redox imbalance, the signaling pathways that modulate the immune system are altered, leading to dysregulation of the immune response and excess inflammation. Okay, so you know we hear about in the recent COVID pandemic, much of the damage to the lungs was because of excessive inflammation, the cytokine storm, and the patients actually died because they were drowning in their own inflammatory secretions. So this is what happens also in the brain. If there is chronic inflammation, there is dysregulation of the immune system, and there is abnormal inflammatory response, and there is excess production of pro-inflammatory cytokines, etc. In a chronic state of oxidative stress, proteins and lipids oxidize, and even the DNA is damaged, meaning even the not only the proteins and the lipids, and the brain is largely fat lipid, and this can be easily oxidized. But more importantly, the DNA, right, which is in the nucleus of the neurons, can be damaged. And when the DNA is damaged, then you are in really, really big trouble. High concentrations of ROS could activate the high secretion of pro-inflammatory cytokines and chemokines and produce a vicious cycle. Okay, so oxidative stress means excess ROS and free radicals, and that will induce the secretion of pro-inflammatory chemicals, chemokines and cytokines. This will cause inflammation. Okay, and if you remember in some other presentation, I have explained to you that oxidative stress and inflammation is a vicious cycle. Oxidative stress causes inflammation. Inflammation causes production of causes more oxidative stress. If you don't break that cycle, then it can lead to disease and death. So in summary, chronic inflammation causes cellular damage or neuronal damage, dysfunction, and even death. Okay, that's the death of our neuron cells. So you have oxidative stress on one hand causing damage. You have chronic inflammation also causing damage, and the two go in a vicious cycle. So we have both, we are in big trouble. Oxidative stress and neuroinflammation are mechanisms that coexist and are interrelated. The pathophysiology of ADHD is associated with oxidative stress and neuroinflammation due to the imbalance between oxidants and antioxidants, neurotransmitter dysregulation, made worse by the medications used for treatment, which, as I explained earlier on, also induce oxidative stress, on top of the genetic and the environmental factors that the affected person already carried. All those factors could be producing oxidative stress and neuroinflammation, which further increases the symptoms and, as a result, trigger a vicious cycle, right, in the brain. That will then cause the symptoms and the signs and how they become ADHD. Let's focus now on the glutathione system in ADHD. In a randomized double-blind placebo-controlled study, it was found that children with ADHD had decreased total antioxidant status. That means they have low level of antioxidants. Moreover, in a randomized double-blind controlled trial, higher concentrations of adrenaline and noradrenaline, these are stress hormones, right? So higher concentrations were found in the urine of ADHD patients, which correlated positively with the degree of hyperactivity, right? The more hyperactive the patient, the more adrenaline and noradrenaline were found. And they were associated with the higher levels of oxidized glutathione disulfide, GSSD. That's oxidized glutathione. Remember? In a healthy person, the ratio of GSH to GSSD is almost 100 to 1, almost. Okay. Whereas in an unhealthy situation, then the ratio goes down with higher levels of GSSG. So in this case, these studies found out that those with ADHD have high levels of GSSG, which means they have low GSH to GSSG ratio. And GSSG, or the oxidized glutathione, is an important marker of the exhaustion of the antioxidant glutathione, or the active glutathione. Okay, so in short, what all this says is that those with ADHD are deficient in glutathione. In plasma samples of patients with ADHD, the antioxidant enzyme activity of glutathione peroxidase, okay, GPX, was significantly lower. The superoxide dismutase SOD activity was not significantly different between patients' controls, and the catalase, another antioxidant enzyme, activity was higher than in controls, but not statistically significant. So the only one that was significant was the glutathione enzyme system. And the lower GPX activity is a reflection of the poor availability of GSH, because we know from the above study that they are deficient in GSH. Okay, because GPX uses GSH in its work, right, of neutralizing free radicals. So when there is very little GSH, also the GPX activity is also low. Okay, and it is postulated that just as in autism, there is a probability of genetic defect in the glutathione production of patients with ADHD. In the case of autism, we know for a fact that some of those suffering from autism actually have a genetic defect that affects their glutathione production. So there may also be a similar problem in ADHD patients. Okay, so now we know the oxidative stress is an important factor. And then when you look at the antioxidant status, then they have low antioxidant. And we look at the glutathione status, we see that they have low glutathione and high oxidized glutathione, which is a reflection of both the deficiency in glutathione and the state of oxidative stress. Okay, so which comes to, this is actually already the last slide. So how can glutathione help in ADHD? Firstly, glutathione is a powerful antioxidant. We know it is the most important intracellular antioxidant. And we know that ADHD is now known to have oxidative stress as a major factor in its pathophysiology. So indeed, glutathione is shown to be deficient in studies on ADHD. So by boosting glutathione, we may help to reverse the problem. Secondly, we know ADHD is associated with neuroinflammation, right? Inflammation of the nervous, nerve cells and nerve tissue. And glutathione is a very powerful anti-inflammatory agent. So again, right, the studies show that glutathione deficiency is a factor, and that may be the reason why there is neuroinflammation, because there isn't enough glutathione to protect the brain from the inflammation. So if we boost glutathione, we may help reverse the situation. Thirdly, as mentioned earlier on, the inflammation is a result of immune dysregulation, meaning there is inappropriate immune reaction to the oxidative stress and other causes of damage or insult to the brain tissue. And we know that glutathione is a powerful immune modulator. that will coax or help the immune system to function normally, to recover its normal function. Just as glutathione is a very good what to say, molecule, yeah, in helping those with autoimmune diseases. That is because in autoimmunity there's also dysregulation. So in this case, the dysregulation results in excess production of pro-inflammatory molecules. So glutathione may help in preventing or slowing down or even reversing those. Fourthly, we know that exposure to toxins and pesticides is a factor, as a risk factor in the development of ADHD. At the same time, we know that glutathione is a powerful detoxifying agent. In fact, it is the main detoxifying molecule used by our body to neutralize these toxins. So again, glutathione has a role in helping prevent or slow down or reversing ADHD by fighting the toxins. And finally, we know that glutathione is a powerful signaling molecule. And ADHD, being neurobehavioral disease, and there is the role of neurotransmitters and signaling molecules in the functioning of the neurons that keep the brain functioning normally, and these are affected in ADHD. So glutathione as a signaling molecule may help in normalizing the functioning of the signaling between the nerve cells. So these are at least 5 ways glutathione may help. And since glutathione deficiency has been shown by studies to be a factor in ADHD, boosting glutathione is indeed something that should have been considered a long time ago. Never mind, better late than never. I've shown to you what are the current treatments. They're just using psychiatric drugs. The glutathione is not yet in the armament, but the current studies show that it is a mistake not to consider boosting glutathione. And I hope this will enter into the list of treatments to be considered in ADHD. Okay, thank you very much. I won't go into repeating all the other stuff about what happens to glutathione, blah 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 blah. Okay.